Right, guys. So, am I visible? Am I audible? Batao jaldi. Let us start now. Yeah, very good. So, everyone is here. All the old students, all of them, the new students. Tushar is here. Faria is here. Romita and Raj is here. Aditya Gawade. Very good. Very good. Very good. Very good. Yeah. So, guys, today on we shall be discussing bacteriology. Now there are two ways that which we can discuss bacteriology. ठीक है? Not only bacteriology. अभी से मैं जो भी discuss करूँगा bacteriology, virology, mycology and all. Most of the questions will be asked from bacteriology part only. क्योंकि bacteriology is very very important. Okay. So regarding this bacteriology, I won't teach you purely bacteriology. ये चीज याद रखो. I won't teach you purely bacteriology क्योंकि you are not going to become microbiologist in future, है ना? So no patient will come and tell you, doctor, I had today Pseudomonas aeruginosa infection, please treat me. No. So he will come to you with complaints. So complaints मतलब क्या? It means you have to go in this approach that we will discuss about the bacteria, we will discuss what toxins it release, but that is microbiology. Along with microbiology, I will integrate this microbiology with dermatology. I will integrate it with medicine, treatment, diagnosis वगैरह discuss करेंगे. I will integrate it with pharmacology and also I will integrate it with pathology. So 4 subjects I will cover here. Okay. So it depends upon you now how well you wanted to learn. So even if you didn't understand what I'm telling right now, so after today's topic, you will purely understand how I'm relating with the other subjects. And also physiology is from yesterday. I thought I will also start integrating physiology also क्योंकि बहुत सारे mechanisms हैं and most of the students already told me that the local faculties there in physiology, they haven't taught you anything, है ना? वैसे any subject, every subject they didn't teach you anything, I think. Okay. So the only source through which you can learn is the MCI faculties, and MCI faculties are not all the time there, right? So whatever it is, in these classes, I will try to cover as many subjects as possible. Okay. एक दो और पास. Right. Right. चलो. So sorry. So now just listen here, all of you. So first of all, we shall be discussing about, देखो, 2 types of bacteria I told you, है ना? एक है gram positive, एक है gram negative. और gram positive, gram negative का differences, you know, gram positive, gram negative, gram staining, zeolation staining also, you know, right? Now what I'm telling you is that gram positive bacteria is widely divided into 3 groups. Gram positive bacteria is widely divided into 3 groups. एक है bacilli, okay. Another one is cocci, and third is branching filaments. So what are the 3 important things? One is called as bacilli. When do you call it as bacilli? अगर ये rod shaped organism है, then you call it as bacilli. Why you call it as cocci? अगर ये circular है ऐसे organism, then you call it as cocci. Why are you calling it as branching filaments? क्योंकि ये सच में ऐसे it is branched in this way. That is why you call this as branching filaments. Okay. Now our topic of discussion will be first regarding the bacilli group. Okay. Now within this bacilli group, bacilli are further divided into two more important things. Two more important things. One is called as aerobic. One is called as aerobic. Another one is called as anaerobic. Sir, what is aerobic and anaerobic? ये चीज you guys are studying from your kindergarten onwards, है ना? Aerobic organisms, anaerobic organisms. You know what are they? I'm not asking examples. You know what is the meaning of aerobic? Organisms which will survive only in presence of air. Organisms which will survive only in the absence of air is anaerobic. Now, coming to aerobic organisms. What are the aerobic organisms? Remember by the mnemonic black. Remember by the mnemonic black. Now, what is black over here? Black in the sense, B stands for bacillus. B stands for bacillus. Bacillus matlab you guys know, right? Bacillus cereus. Bacillus and Clostridium are the only two species which releases spores. Ye cheez yaad hai na? Yes or no? Everyone, you remember this thing? Bacillus as well as Clostridia are the only two species which releases the spores. So that Bacillus species, Bacillus के बाद L stands for Listeria. Listeria. A stands for aerobic and C stands for Corynebacterium. Corynebacterium. Corynebacterium matlab Corynebacterium diphtheria and all. Okay. Coming to anaerobic, we shall be discussing the first organism that is called as Clostridium. You see, Clostridium is also one which releases the spores, Okay. Abhi, now, important thing is that jitne bhi aerobic organisms I have mentioned over here, all these aerobic organisms are catalase positive. Matlab they release catalase. Catalase का action क्या है? I've already told you. Never ever add hydrogen peroxide deep cut to oval story. You remember, right? So what I'm telling you is all these organisms are catalase positive. They are catalase positive. Now, when it comes to these organisms, Clostridia जो है, it is catalase negative. Cat negative. Cat negative matlab catalase negative. Okay. So first what we shall do is that we shall discuss about Clostridium. Right now itself, remember Clostridium species jitne bhi hai, right? From the Clostridium species, 100% one question will come, one or two questions. Did the video struck? Is everything good? Right. Right. So 100% one question will definitely come from the Clostridium. Remember this, okay? Pakka one question will come from the Clostridium species in your exams. Any exam you take, बहुत important है. Now, coming to the Clostridium, if I ask you what are the properties of Clostridium, what will you tell? What will you tell is that Clostridium, first thing ये है कि Clostridium is gram positive, okay? Clostridium is a bacilli, matlab gram positive bacilli. It is anaerobic organism and it is catalase negative. These are the four properties, okay? So a topic of discussion would be regarding the Clostridium species. Clostridium species. So Clostridium species, the first property is it is gram positive. Second thing, it is bacilli, gram positive bacilli. Third important thing is it is catalase negative. Fourth important thing is it is anaerobic. Anaerobic. These are the things you understood. अगर इसको ऐसे ही रटना है रट लो, or else what I will prefer is every bacteria you study with the table. That will be very easy, I'm telling you. So regarding this Clostridium, how many different Clostridium species we have got? We have got four important Clostridial species. एक हो गया आपका Clostridium tetani, okay. Another one is Clostridium botulinum. Clostridium botulinum. Another one is Clostridium perfringens. Clostridium perfringens. And the last one is Clostridium difficile. Difficile. So Clostridium tetani, Clostridium botulinum, Clostridium perfringens, and Clostridium difficile. So in our today's class, we shall discuss about all these 4 important bacteria. So first, let us start about the famous one, all of you know, that is Clostridium tetani. Okay. So our topic of discussion would be regarding Clostridium tetani. Now, regarding this Clostridium tetani, one very important thing I want to tell you is that Clostridium tetani, you know, it will cause what? Tetanus. ये तो पता होगा. Clostridium tetani would cause tetanus. It would cause what? It would cause tetanus. This thing you know. But what I'm telling you is that Clostridium species जो है, right? These species release spores, and these spores can live up to 1,000 years. Okay? Clostridium species का spores जो होते हैं ना, spores are very stable spores. Now, how are these spores stable? How are these spores stable is that you have to look at the structure of Clostridium first. See, this is how the structure of Clostridium looks. This is the Clostridium. Abhi, within this, how is this Clostridium looking? Isn't it looking like a tennis racket shaped or drumstick shaped? Yes or no? So can I write it as it is looking like tennis racket, or it is looking like drumstick shaped bacteria? Tennis racket or drumstick shaped bacteria. Okay, this was asked in the exam previously. Tennis racket or drumstick shaped bacteria is your Clostridium. Okay, so that is your Clostridium. Now, in the center of this, in the center of the head, whatever you see, in the center we have got over here a very important acid. ये acid का नाम है dipicolinic acid. ये भी another important question. Dipicolinic acid. Okay, it is because of the dipicolinic acid की वजह this Clostridium has attained that stability. You asked me how is this Clostridial spores are living for 1,000 years and all, right? So in the center we have got a chemical called as dipicolinic acid. Because of dipicolinic acid, this spores can survive for up to 1,000 years and more. Okay, so it is because of dipicolinic acid which is making the spore very stable. So all of you are clear till here. Everyone, be fast, fatafat. I'll go to the risk factors now. Everyone is clear, right? Right. Now coming to the risk factors, which group of individuals are at a higher risk of contracting this infection? Which group of individuals are at a higher risk of contracting this infection? The first important group is, for example, if any patient had trauma matlab kya? Injury. Or let us say if any patient is having chronic wounds. Obviously, how will you get tetanus? How will you get tetanus when you fall down suddenly, right? You get a wound and you have not properly washed it. है ना, वहां पे अगर Clostridium का spore से, these spores will enter into your body and it starts causing the disease, right? So, you know, mainly it is because of injury. Third most important is lack of vaccinations. If you haven't vaccinated against this, you are at a higher risk of developing this Clostridium. So lack of vaccinations. Lack of what? Lack of vaccinations. Clear all of you? अभी यहां तक जो मैंने डिस्कस किया, this is all the formality part. Now let us enter into the real pathogenesis. All of you, if you are writing anything, stop writing. Just watch it like a movie, whatever I'm teaching you right now. Okay, so just concentrate on this. Now we will see how Clostridium tetanus is causing tetany, right? Again, I'm telling you, don't write any notes. Okay, you will miss the flow. Clostridium tetani basically releases 3 different types of toxins. Okay, Clostridium tetani releases 3 different types of toxins. What are those 3 different types of toxins? One is called as tetanospasmin. Another one is called as tetanolysin. And last one is called as non-spasmogenic toxin. Okay, these are the 3 toxins that are released by this Clostridium, tetanospasmin, tetanolysin, and non-spasmogenic. Out of these three, which are dangerous? Tetanospasmin and tetanolysin. What is the use of non-spasmogenic toxin? Till now, in the articles also I have read, till now there is no known function of this toxin, non-spasmogenic toxin. Okay, there is no function that is so far known. So just look at this picture over here. This is the same picture I've drawn, yes or no? So you see, this is how the shape of the Clostridium tetani is. And what shape can you tell? This is called as a tennis racket shaped. What is this? This is called as a tennis racket shaped or drumstick shaped. Tennis racket or drumstick shaped. Now let us enter into the physiology part of how this is acting. Again, don't write any notes, just watch whatever I'm teaching. Right. Now, you know that this structure which I'm drawing right now, this structure is the end of the neuron. ये bone नहीं है. This is end of the neuron. Okay. And this structure which I'm drawing right now, this is the beginning of another neuron. So between both the neurons, whatever space that is left over here, all of you know that this space is called as synaptic cleft. Yes or no? This space is called as synaptic cleft. This space is called synaptic cleft. Now, one neuron, see, what is the name of this particular neuron? This neuron is called as alpha motor neuron. This particular neuron name is called as alpha motor neuron. Remember one thing, the function of alpha motor neuron is muscle contraction. What is the function? I think recently you had MCI classes from Dr. Sriteja, right? So you might have known all these things. You might have juniors ke liye, acha, not for you. Fine. Chalo, koi baat nahi. So alpha motor neuron, and this alpha motor neuron causes muscle contraction. And remember one thing, alpha motor neuron is 24/7 activated. Agar ye alpha motor neuron is 24/7, it is activated, then 24/7 my muscles have to be contracted. Why my muscles are not contracting? The reason why my muscle is not contracting is that whenever I want to contract, if I want to contract my hand, I'm contracting and I'm lifting the bottle. If I want to relax, I'm relaxing. Now, what is this mechanism that is happening is the first neuron which you can see on the top, this particular neuron releases a chemical called GABA. All of you should know what is GABA. GABA is nothing but gamma amino butyric acid. Okay. So GABA. So what is this GABA? GABA is an inhibitory neurotransmitter. Inhibitory NT matlab neurotransmitter. Okay. Inhibitory neurotransmitter. Not only GABA. Okay. Not only GABA, even glycine is also an inhibitory neurotransmitter. This is an extra point from physiology. I'm telling you. Even glycine is also an inhibitory neurotransmitter. But यहाँ पे क्या release हो रहा है? What is getting released? GABA is getting released. And what will GABA do? It will inhibit the next neuron. You're getting it? This GABA will inhibit the next neuron. So when it is inhibiting the next neuron, so alpha motor neuron will not work, no muscle contraction, and my muscles are relaxed. Okay. If I want my muscle to contract, then what will I do? I will stop neuron number 1 to release GABA. अगर ये GABA release नहीं किया, then what will happen? Alpha motor neuron, however it is under 24/7 action, it keeps on muscle contracting. Till here you understood, yes or no? Very good. Very good. Now let me enter into some more deep concepts, exactly what is happening. Again, I will draw the same picture over here. Now, another important thing over here is that here within this, you have got some structures like this. These structures are called as vesicles. ये vesicles का नाम है synaptic vesicles. Okay, synaptic vesicles. Now, another important thing is there is a gate over here. ये देखो, see, there is a gate over here. Okay. Now, what are these gates? These gates are called as calcium gated channels. ये देखो, these are your calcium gated channels like this. Okay. Another important thing you need to know is that these calcium gated channels are having two important proteins like this. Okay, so these proteins which are located here, these proteins which are located here, this is called as syntaxin. Proteins का नाम है syntaxin. Okay, now synaptic vesicles जो है, right, synaptic vesicles are also having a protein over here. This protein which is present for the synaptic vesicles is called as synaptobrevin. What is the name of this? The name of these proteins are called as synaptobrevin. Synaptobrevin. So how many different types of proteins are there? One is syntaxin, which is attached to the calcium gated channels. Another one is synaptobrevin, which is attached to the vesicles. Now both of these proteins together, you call them as snare proteins. What are these proteins called? These proteins together are called as snare proteins. I hope till here you understood. Now, within the synaptic vesicles, what do you have? Within the synaptic vesicles, I have got a neurotransmitter. What is the neurotransmitter that is located within the synaptic vesicles? That is what is called as your GABA. Within this synaptic vesicles, you have got GABA. Okay? और ये नाम लिखना भूल गया. This is your synaptic vesicle. Synaptic vesicle which is containing GABA. Okay. Now look what is happening. What is happening is that whenever I want to contract, whenever I want to relax my muscle, okay, what will I do? Electrical impulses jo hai, right? These electrical impulses, they are passing along the membrane of the neuron. Obviously, they pass along the membrane of the neuron, and these electrical impulses come down to the synaptic terminal. Ye dekho, this part is called as synaptic terminal. So what will happen? Positive charges are coming down. Positive charges मतलब पता क्या? Calcium is coming down. Calcium is positive, right? So what will happen is that this calcium, just look here closely. One calcium ion attaches to one syntaxin molecule. Another calcium ion attaches to another syntaxin molecule. So calcium ion is positive. Calcium ion here is positive. Positive क्या होगा? अट्रैक्ट होगा कि रिपेल होगा? जल्दी बताओ फटाफट. Very good. So positive will repel. So what will happen when positive will repel like this? This is how the picture looks. When both the positive charges will repel, this is how the image looks. Here they go. This is how the image looks. Yes or no? Now, once the positive charges are repelled, the gates are open now. Now, what will happen is that this GABA containing neurotransmitter, this synaptic vesicle will come like this and it will fix into this. Here they go. It is coming like this and it is very nicely fixing into this. एक बार जब fix हो गया ना, now what will happen is that this vesicle will blast. Once this vesicle will blast, this vesicle starts releasing GABA into the synaptic cleft. And this GABA will act on the next neuron. And you know what GABA will do? Previously, I told you it will inhibit the next neuron. And that is the reason why your alpha motor neuron is inhibited. Alpha motor neuron is inhibited. So if alpha motor neuron is inhibited, do you think I will have muscle contraction? No, my muscles will be relaxed. Okay, my muscles will be relaxed. Now, this mechanism happens in you and me normally. But in a patient who is contracted with Clostridium tetani infection within his body, right? Let us say I met with an accident, okay? Or kuch wound laga, and I did not wash these wounds. I just came to my home, right? With the water, simply I washed the wounds, no antiseptic, nothing, and I'm doing my daily works. Now, unfortunately, the spores of Clostridium tetani went into my body, into my blood. And what is happening? Within my body, this Clostridium tetani is releasing three important toxins. Out of this, these two important are important. These two toxins are important. One is tetanospasmin and tetanolysin. You know what this tetanospasmin and tetanolysin will do? These two toxins tetanospasmin and tetanolysin. These two toxins, they start damaging my snare proteins. Once my snare proteins are damaged, which means, I will no longer have this synaptobrevin. I will no longer have this syntexin molecule. Damage हो गया. अगर syntexin नहीं है, synaptobrevin नहीं है, do you think the vesicle will come and fuse? Vesicle will not fuse. If vesicle is not fusing, do you think GABA is released? GABA is not released. Yes or no? GABA cannot be released. If GABA is not released, do you think this alpha motor neuron is inhibited? No. Alpha motor neuron, now what will happen? Happily, it will keep on firing 24/7. When it keeps on firing 24/7, the body will be contracted like this, and this is what is called as tetanus. All of you understood the concept? Everyone? Tell me fast, 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 fast. Perfectly understood. So now you understood how tetanus is actually happening. So tetanus is mainly happening because of damage to the snare proteins. Okay, damage to the snare proteins. Fine. So because of this, the patient muscles are hyper contracted. They are contracted too much. This kind of hyper contraction for a long time. See, I'm contracting my muscles, I can relax. But in this patient, this contraction will be for a long duration. So that is why you call this as sustained muscle contraction. Sustained muscle contraction. This is called as sustained muscle contraction. Okay. Now here, four important things you're going to see. What are those four important things? Very, very crucial symptoms. This kind of sustained muscle contraction. Dekho guys, I am calling this as paralysis. From today onwards, in your mind, you have to remove this misconcept that paralysis matlab हाथ पैर नहीं उठेगा. This is called paralysis. No, that is not only called paralysis. There are two types of paralysis. If muscle is not doing its daily activities, you call then it as paralysis. Okay. For example, if I'm contracting my muscle tightly, because of this contraction, will I be able to do my normal activities? Batao. Will I be able to chat? Will I be able to type? Will I be able to write because of contraction like this? No. Matlab ye bhi paralysis hai. But what kind of paralysis is this? This is called as spastic paralysis. Spasticity, tightness. On the other hand, there is another paralysis where your muscles are not working at all. You can't even contract your muscle. Even if you are not able to contract your muscle, iska matlab kya hai? Then also you won't be able to do daily activities. That is also called paralysis, and that paralysis is called flaccid. Flaccid matlab deela, very weak. Okay, that paralysis is called as flaccid paralysis. So here, what kind of paralysis I will say? Spastic. I would say spastic paralysis. After this, the second important thing I would say is, in this patient, there will be risus sardonicus. Risus sardonicus means the face muscles will be contracted and this face looks like this. This is called risus sardonicus. I'll show you a picture if I have. Here they go. Look at this patient. You see, all his facial muscles are contracted. This is called as risus sardonicus. What is this called? This is called risus sardonicus. Third important thing is iska masseter muscle, buccinator muscle. From anatomy you've studied, right? Masseter, buccinator and all. So all these muscles will be contracted. So he can't even open his jaw. So that would lead to locked jaw. Okay. Locked jaw is also called as trismus. Trismus. And fourth important thing is that on the back side, there are extensor muscles, which are responsible for extension like this, right? All these extensor muscles are contracted. Jab extensor muscles are contracted, kaise hoga body? In this way. You have seen Conjuring, not Conjuring, Insidious. Insidious movie, you see on the bed, the girl, she'll be completely, extending her back in this way, है ना? So that kind of position you call it as, that position you call it as opisthotonous position. Opisthotonous position. Opisthotonous position. ये देखो, this kind of position. You see this position where you are contracting all your back muscles. This is called as opisthotonous position. I don't have a real patient here. चलो जो भी है, this is your opisthotonous position. All of you understood? Yes or no? Now, sometimes the tetanus can also affect a neonate. That is called as neonatal tetanus. ये कैसे हो सकता है? Neonatal tetanus. Neonate in the sense a newborn, right? How can a newborn get infected? Will the newborn immediately after the delivery, will he go play with his friends? No. Then how is he going to get affected? Now, during the delivery, let us say during a not C-section, during normal delivery also, what you do is that you cut the umbilical cord. Now, if you are using the forceps which you are using are not properly sterilized, तो क्या होगा? Through these unsterilized forceps, the spores can land on the umbilical stump. Umbilical stump की वजह they can enter into your body and cause neonatal tetanus. So the most important risk factor for this neonatal tetanus is unsterilized artery forceps which are used for delivery. Unsterilized artery forceps for delivery. Okay, unsterilized artery forceps for delivery. So this is one of the important thing. Okay, okay. So you are telling that this is a thing that is happening. Now I don't know when I will go play with my friends. I don't know when I get hurt and all. So is there any medicine that you can give to me before itself, so that I won't, even if I fall down and I get hurt, I won't get this kind of infection? For that, you need to use something called as vaccines. No medicines, only vaccines. What vaccines do we have? We have got 3 different types of vaccines. The first vaccine is DTaP vaccine. Okay, diphtheria, tetanus, and activated pertussis. Diphtheria क्यों है? Diphtheria, you know diphtheria. Tetanus, you know. AP मतलब activated pertussis. Pertussis is whooping cough. Sir, tetanus के लिए अलग सा vaccine नहीं है? No, you will get these vaccines in combination. Okay. Second important thing. After this, you have to take a next dose that is called as Tdap. Again, tetanus, diphtheria, activated pertussis. And after that, after 10 to 14 years and all, you need to take TD vaccine, tetanus and diphtheria vaccine. Okay, tetanus and diphtheria vaccine. These are the vaccines which you take. Fine. Let us say, sir, now I contracted this infection. You know, I mean, right now within my body, tetanospasmin is there, tetanolysin is there. Now, within few minutes or few hours, I am going to develop tetanus. Now, what will you give to me? What will you tell? What is the medicine which you give to me? What I will give to you is that I will give you one immunoglobulin. उसका नाम है tetanus immunoglobulin. That is called as tetanus immunoglobulin. And doctor, what is the function of this? This tetanus immunoglobulin, the main problem right now in your body is tetanospasmin. So this tetanus immunoglobulin will go and neutralize the tetanospasmin. It will neutralize that tetanospasmin. अगर tetanospasmin neutralize हुआ, voice is lacking. Delay होना. Sorry, Anil called you. Right. So you will neutralize that tetanospasmin. So when you neutralize that tetanospasmin, what will happen? What will happen is that tetanospasmin will not work. If it will not work, do you think it will inhibit the snare proteins and all? No, right? So this immunoglobulin is also given another name. This treatment is given another name. That is what is called as tetanus antitoxin. So basically you will give tetanus antitoxin over here. Okay, tetanus antitoxin is given to this patient. So everyone is clear with this? Yes or no? You perfectly understood the concepts. Jaldi batao. Very good. Now the next important thing is, sir, what complications can happen? What can be the complications? What can be the complications are, the first important complication is, okay, fine, your muscles of upper limb and lower limb are contracting. Uski wajah, nothing is happening to me. Fine, I'm not able to do my daily activities. But what if your respiratory muscles are contracted? Batao. Your respiratory muscles and intercostal muscles, external intercostal, internal intercostal, diaphragm, main muscle of inspiration, sternocleidomastoid muscle, right? Trapezius muscle and scalene muscles, all these are muscles of inspiration, right? So when these muscles of inspiration are contracted, you keep on taking air inside. Will you be able to breathe? No. So patient will immediately die. So complication can be spasm of respiratory muscles. Spasm of respiratory muscles. Spasm of respiratory muscles. Second important thing, when the muscles are contracted, patient will have a spasm in this way, right? So when he's taking a deep breath inside like this, sometimes it might happen like this, that the contents from the esophagus can jump into your trachea, and from there it can enter into your lungs. So this is called as aspiration pneumonia. Aspiration pneumonia. Now into your lungs, for example, let us say food materials enter inside into your lungs. Don't you think patient will have aspiration pneumonia and then infection of the lungs? Patient will have pneumonia. You're getting it? Pneumonia, zaruri nahi hai ki pneumonia is only caused by streptococcus pneumonia. Pneumonia can be caused by wide variety of things. Simple thing you do, take juice, pour it in your nose, they will enter into your lungs. Tomorrow you will end up having pneumonia. You're getting it? So this is a thing. Now another important thing, sir, apart from tetanus antitoxin, is there anything that you can give? So if I have to give anything, just look at the concept. What is deficient here? Yahan pe, the thing that is deficient here is GABA. There is no GABA here. If there is GABA, the problem will be solved. Yes or no? But think one thing, before getting tetanus, before this patient getting tetanus, there was sufficient amount of GABA here. There was sufficient amount of GABA. Everything was normal. Now he developed tetanus. Now what I will do is that I will give such a drug. Okay? I will give such a drug. What this drug will do is that this drug will increase, it will increase the concentration of GABA in the synaptic cleft. It will bring GABA from every part. Okay? From every part of the body, and it will concentrate that GABA within the synaptic cleft. If it will concentrate that GABA within the synaptic cleft, then problem is solved. GABA will inhibit the next neuron. Yes or no? So that drug which does this action is nothing but called as benzodiazepam. Okay, so that is BZP, called as benzodiazepam. What this benzodiazepam is doing? This is preventing the muscle contraction. Prevents the muscle spasm. How it is preventing the muscle spasm? Mechanism of action in your pharma, it will come. It increases the concentration of GABA. Kahan pe? In the synaptic cleft. In the synaptic cleft. It increases the concentration of GABA in the synaptic cleft. Okay, all of you understood? ये देखो neonatal tetanus मतलब ये है. Very clear picture. Yes or no? This is a case of neonatal tetanus. And I also told you, अगर umbilical stump infect हुआ, right? Because of this unsterilized artery forceps, this umbilical stump is infected, that will cause tetanus. ये देखो infected umbilical stump. ऐसे होगा infected umbilical stump. Everyone is getting it? Everyone is clear with the things which I'm discussing right now? Yes or no? Very good. Now let us do the questions which are repeated previously. Only 2 questions, 3, काफी questions hai. What I will do is that I will discuss only 2 questions and move on to the next. If you understood these 2 questions, if you have told me the answer for these 2 questions, then GABA ज्यादा होगा तो contraction नहीं होगा muscle. Yes, muscle will not be contracted, but GABA also it has got its own action, right? 10 to 20 minutes it will act. उसके बाद फिर muscle contraction होगा, right? So what I'm telling you is that if you do these 2 questions, right? These are the two questions which are repeated previously in USMLE exams as well as in the PLAB exams. So if you have done these two questions, it means you understood the concept. Any question will come, definitely you will answer from this. Okay? So let us discuss now. 15-year-old boy is brought to the emergency department, okay, by ambulance after his mother found him having muscle spasms. Okay, he was having muscle spasms, so her mother brought him to the hospital. Not only muscle spasms, stiffness bhi hai. Muscle spasm and stiffness. His mother stated that he scraped his foot on a rusty razor. ये देखा, he scraped his foot on a rusty razor on the bathroom floor 2 days before. Okay, on presentation temperature to 38, fine. Blood pressure is 108/73, ठीक है, थोड़ा hypotensive है but fine. Pulse is 122, respirations are 18. On physical examination he is found to have severe muscle spasms and rigid abdominal muscles. Okay. In addition, he had a dirty appearing wound on his right foot. Matlab, they did not take care of the wound. Okay. So the patient's mother does not recall anything further. Further vaccinations since the age of 12. Okay. Guys, एक चीज याद रखो, which will be useful for your entire life in exams also. For example, let us say I have taken vaccine. Okay, वैक्सीन का ना एक फर्स्ट डोज होगा, सेकंड डोज होगा और थर्ड डोज को बूस्टर डोज बोलते हैं. ओके, सम वैक्सीन्स विल हैव फर्स्ट डोज एंड सेकंड डोज इज अ बूस्टर डोज. So after taking vaccine, let us say for diphtheria and all, the vaccine gap will be for 10 years. Okay, after 10 years again you have to take the vaccine, again you have to take the booster dose. So I got an injury, for example, I went to a doctor will ask the first question, did you finish taking all the vaccines? You will tell yes, and he will ask you when was your last vaccine. If it is 9 years or 8 years, then fine, क्योंकि 10 years तक validity होता है ना. If it is more than 10 years, then it is a problem that again you have to take a vaccine. Now I will tell the doctor, I don't remember, maybe 10 साल से ऊपर हुआ होगा, right? Maybe it has been more than 10 years, I think, I don't remember it. Then still the doctor will give you another booster dose. Even if you have taken it and if you don't remember it, that patient is considered as he has not taken a vaccine and you give the dose. Another patient is coming to me and telling the same wound and all. Now you will ask the patient, have you taken a vaccine? Now the patient will tell, I don't remember, doctor, I don't remember, maybe in childhood I have taken vaccines, I think. Yes, I have taken, but I don't know how many doses I have taken. Any patient who did not take a vaccine or any patient who don't remember that he took a vaccine is considered as unvaccinated patient. So you have to start all the doses again. Keep this point in your mind. Everyone understood? Sultan, benzodiazepine का एक ही mechanism of action है. It will concentrate. Okay, it will concentrate the GABA within the synaptic cleft. अगर ज़्यादा GABA है तो muscle contraction will be less. Okay, all of you understood this vaccine concept which I told you? Everyone? Yeah. Just look here now, which of the following treatment for in this patient, she does not recall any further vaccination since age 12. Matlab, you are not able to recall in the sense this patient is considered as unvaccinated patient. Okay. Which of the following treatment should be provided to this patient? Abhi answer batao. What will be the answer? Very good, very good. Wound debridement to karna padega. Why are you doing wound debridement? Because he is having a dirty wound, dirty appearing wound. Okay. Antitoxin. Definitely you should give antitoxin and a booster vaccine also. Clear all of you? Very good. So you should also give a booster vaccine. 6-year-old boy who recently immigrated to the United States is brought to the emergency department by his mother. Okay. His mother states that the boy has a deep cut several days ago, okay, which thoroughly washed and bandaged at home, okay, and he had now been having severe muscle spasms, okay. So when you examine the boy, you notice the findings in the figure A. ये देखो. What is the figure A? Is he crying? He is not crying. What is he doing actually? He is actually having rhizus sardonicus. Okay, and look at his hands also, contracted, completely contracted. So right now he is in a condition of tetany. Okay, now he is asking which of the following best describes the pathological mechanism. पूछ रहा है यहाँ पे. What is the mechanism behind the boy's presentation? Who will tell me the answer? Very good, Nidhi Jain, Shravya, very good. Ashfaq, Syed Fatima, very good. Arbina, very good. Very good, guys. Excellent. So, destruction of the protein leading to inhibition of neurotransmitter. कौन सा protein है वो? Snare protein. Snare proteins मतलब your synaptobreven and syntexin. Okay, synaptobreven and syntexin. Let us do this question also. बाकी दो questions you will tell me the answer later on. ठीक है? Once when I send the PDF. PDF send करने के बाद नीचे comments होना चाहिए, है ना? Comments मतलब ये देखो, I need answer for these two questions. ठीक है? 71-year-old male is brought to the emergency room. Seventy-one-year-old male is brought to the emergency room by his caretaker and presents with difficulty breathing, muscle rigidity. Muscle rigidity के साथ difficulty breathing भी है. Maybe muscle spasms. Face, neck, back, upper extremities, all of them are contracted and profuse sweating. The intern also notices a large wound on his head near the back, okay, of his right ear, which his caretaker has bandaged up. The caretaker explains that the wound was a result of a fall while walking in his backyard. He fell down there, got an injury. The intern performs a quick physical exam and observes increased reflexes. Patient was intubated to assist his breathing. Chalo, and was given diazepam. Diazepam matlab kya? Benzodiazepam. Okay. Metronidazole and immunoglobulin after the blood work came back. Which of the following neurotransmitter is affected? Answer batao. What will be the answer? Very good. What did I tell you? GABA or glycine is an inhibitory neurotransmitter. So the answer will be glycine. Or you can also write down here as GABA. Okay? GABA. Right. Chalo. Let us, we have successfully finished Clostridium tetani. All of you understood Clostridium tetani? Yes or no? Be fast, fatafat, jaldi. Next, we'll discuss about Clostridium botulinum. Everyone understood? Very good. So now the next important thing we shall be discussing right now will be Clostridium botulinum. Clostridium botulinum. Now, one very important thing is that we know Clostridium tetani, we know Clostridium botulinum, we know Clostridium difficile, and we also discussed about Clostridium perfringens. Now, what I'm telling you is that out of all of this, if you look at Clostridium tetani, if you look, this is the structure of Clostridium tetani. Okay. If you look at the remaining, this is how the remaining Clostridium tetani are. So, Clostridium species are. Clostridium tetani is having a spore on the top of the head, right? So this kind of spore is called as terminal spore. What is this called? Terminal spore. Baki, Clostridium botulinum, difficile and perfringens, just beneath the terminal spore. From anatomy, I have taught you guys, anything below is called sub, infra. Yeah, so this kind of spore is called as subterminal spore. One is called terminal spore और दूसरा क्या होगा? Subterminal spore. Very good, Nidhi, very good. Now I will show you the slides. In the exam, if these slides come, you guys should definitely answer, not miss a single question. ये देखो, अभी ये बताओ ये क्या है? What is this? Clostridium tetani or remaining species? ये बताओ. Just by looking at the spore, you should tell me the answer. Very good. कैसे? Because it is having what kind of spore? It is having terminal spore. Terminal spore. अभी यहाँ पे भी देखो, all of you look here. See, this is also having terminal spore here. ये देखो terminal spore. But यहाँ पे देखो, all of you look at this. What is this spore over here? What is this spore? This is called as subterminal spore. Very good. This is called subterminal spore. This is called subterminal spore. Terminal spore and subterminal spore. Right. So we are discussing currently about botulinum. Okay. Clostridium botulinum. Clostridium botulinum releases a toxin. वो toxin वहां पे 3 toxins, spasmogenic, non-spasmogenic, tetanolysin, tetanospasmin, and non-spasmogenic. And here Clostridium botulinum releases only one toxin, that is called as botulinum exotoxin. It releases botulinum exotoxin. What does it release? It releases botulinum exotoxin. How many botulinum exotoxins are there? There are 8 different types of botulinum exotoxins. What are the names of 8 different types? एक होगा A, दूसरा होगा B. After that, anyone? Next one we have is a C. After C, what do we have? You remember? Old students, you remember? We have got C1, okay? D9. We have got C2, C1, C2. Then we have got D, then we have got E, then we have got F, then we have got G. So completely there are 8 different types of Clostridium botulinum. Okay? अभी ये बताओ, all of you think Clostridium botulinum मतलब what disease does it cause? Anyone? What is the disease does that Clostridium botulinum cause basically? Botulism. Botulism क्या होता है? What is botulism? Romita is telling food poisoning. Very good. Food poisoning, very good. But the answer is wrong. Botulism, matlab, I agree that it is food poisoning. But if you are talking about Clostridium botulinum not only causes food poisoning. Okay? Clostridium botulinum not only causes food poisoning. I will tell you, look now. How many Clostridium toxins are there? 8 exotoxins are there. Out of all these 8, only C2. Out of all these 8, only C2 causes food poisoning. Only C2 causes food poisoning. The rest cause, they are all neurotoxins. The rest, very good, Syed Fatima, very good, nervous disorder. The remaining A, B, C1, D, E, F, G, remaining all of them are neurotoxins. अब बताओ Clostridium botulinum majority, in the majority basis if we take, it is neurotoxic. Only one toxin of that will cause food poisoning. So the remaining causes what? Remaining are neurotoxins. Remaining or what? Remaining are neurotoxins. Now you might get a doubt, sir, how much amount of botulinum when we take causes, I mean, it is a lethal dose. It causes food poisoning. For example, if I take 1 grain of botulinum put in my mouth, I will get food poisoning? No. The amount of botulinum concentration you need is called as lethal dose. Kitna dosage mein lena chahiye? 1 paracetamol tablet, will you die? No. If I take 10 to 20 paracetamol tablets, then I will die. Okay. So the lethal dose which you need to take is 1 to 2 microgram. Okay. So this is the lethal dose to cause what? This is the lethal dose to cause food poisoning. Lethal dose to cause food poisoning. Clear all of you? Right. Let us discuss about what are the risk factors. What are the risk factors? Now, what will be the risk factors? The first risk factor is that when you go out in the market there, you go get canned foods. Any food that is stored in the canned, there is botulinum sleeping inside. Okay. So never ever eat canned foods because canned foods are contaminated with botulinum spores. Okay. Or not only that, even processed foods. Canned foods are processed products, whatever are there, you can never ever take them. Second important thing, ingestion of raw honey. Ingestion of raw honey. You know who will basically take this raw honey? Mostly raw honey in Western countries, we basically feed to the newborn children. Okay, so that is the reason why the newborn children are at a higher risk of developing this botulism. That is why this kind of botulism, where because of this raw honey ingestion, you get the botulism. That botulism is called as infantile botulism. Because most commonly you see in infants. Okay, see, neonates, you won't give them biryani, right? You won't feed them with biryani, pizza and all, right? So you basically give them liquid foods, for example, raw honey and all. And third important thing is contaminated foods. Contaminated foods. So these are the most important risk factors. Okay. How many types of botulism do you have? There are three different types of botulism I have. What are those three different types of botulism? First botulism is called as, all of you look here. Let us say this is a cup where a beautiful dish is served to you. Okay. So let us say beautiful dish is served to you. Now you start eating this, but you don't know that already on this beautiful dish, there are some botulinum exotoxin that is already sitting inside. Okay. So what is this beautiful dish containing? It is containing botulinum exotoxin. Now what will happen? You will ingest this food. Now when you are ingesting this food, it means botulinum exotoxin is directly entering into your body. Exactly within 12 to 36 hours, the music starts. Okay. What the music? The symptoms appear. Exactly after 12 to 36 hours, slowly the symptoms will appear. So this kind of botulism, you don't see it in infants because infants don't eat the food, right? Rice and all. So this you see in adults. That is why this kind of botulism, you call it as adult botulism. And this botulism is more common. So you call it as classic botulism. Clear, all of you? So this kind of botulism, you call it as adult or classic botulism. Adult or classic botulism. So this kind of botulism, you call it as adult or classic botulism. All of you understood? Yes or no? Fadafat. The next important botulism which we have to discuss over here. Now, in this kind of botulism, what you do is that this is most commonly seen in infants. Why are you most commonly seeing it in infants? Because in the infants, I am going to feed them raw honey. Okay? मतलब raw honey के अंदर, within the raw honey, you are telling there is botulinum exotoxin? No. Within the raw honey, I have got spores. So if I'm feeding a newborn, it means raw honey spores, the spores which are present within the raw honey, they are entering into your body. Now what will happen? These spores will pass all the way down to your large intestine. All the way down to your large intestine. Once the spores pass down to the large intestine, there in the large intestine, the spores start releasing exotoxin. Abhi, why are you telling all these things? The reason is that first case mein dekho, directly you are taking exotoxin, within 12 to 36 hours, the symptoms will appear. But yahan pe, first you are taking spores should enter into your intestine, then the spores will release exotoxin, then after some time, you will get botulism. Matlab, early botulism is seen in adult, the symptoms lately appear in infants. Clear, all of you? In infantile botulism, the symptoms will appear much later. So this kind of botulism, you call it as infantile botulism. Infantile botulism. So remember this, infantile botulism. Okay, this is infantile botulism. Next and last important thing is called as wound botulism. What is this? This is called as wound botulism. Wound botulism kaise hoga? How will the wound botulism happen? Because of contaminated wounds. Because of your contaminated wounds. So, how many different types of botulism we discuss? One is called as adult botulism or classic botulism, infantile botulism, और तीसरा क्या है? Wound botulism. Now, out of all these three botulisms, the most common type of botulism is your infantile botulism. This is the most common type of botulism. The rarest type of botulism is wound botulism. बहुत rare है. Okay, this is very, 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 very rare. Right. All of you understood this thing. If you understood this thing, now I will enter into the physiology part. Everyone, yes or no, jaldi. 50 students are there here, but बाकी सो रहा है. मुझे लग रहा है पक्का सो रहे होंगे. All the 50 are active. बताओ. All the 50 students are active here, perfectly active. सच्ची एवरीवन देखो वो सेम कमेंट सेम स्टूडेंट सेम कमेंट्स नहीं अलग सा कमेंट्स चाहिए मुझे आई नीड डिफरेंट कमेंट्स नाउ राइट चलो now let us discuss about the pathophysiology over here. Now coming to the pathophysiology, what is the pathophysiology? Just all of you concentrate to whatever I'm teaching to you. Okay, don't write now, don't write any notes, don't write any notes. So you see this is a stomach, right? This is your stomach like this. And let us also tell that this is your blood vessel over here. Okay. And finally, let us draw the neurons. See this particular neuron over here. This is a presynaptic neuron. And यहाँ पे आएगा अपना postsynaptic neuron. Okay. Now, remember one thing. What is an important thing you need to remember is that if muscle has to contract, then you need a chemical, a neurotransmitter called as acetylcholine. Acetylcholine is nothing but ACH. Okay. So space nahi hai yahan pe. What I will do is I'll just make up some space over here. Right. So what I'm telling you is, if a muscle has to contract, what is the chemical you need? You need acetylcholine. Acetylcholine को ऐसे बोलते हैं ACH. ACH stands for acetylcholine. For first years, I'm telling. ACH stands for acetylcholine. Okay. Now, next important thing is that, look here now. How will the infection start? How will the infection start is that in the neurons here, what are the things you know already? You know that here we have got synaptic vesicles. है ना ऐसे synaptic vesicles है अभी इस synaptic vesicle के अंदर the chemical neurotransmitter which you have is not GABA. This time the neurotransmitter which you have over here is acetylcholine, ACH. Okay, again the same thing, same story. Here you have got, ठीक है, here you have got a protein. This is called as synaptobrevin. याद है? This is called synaptobrevin. And here let us say you have got calcium gated channels. These are your calcium gated channels over here. And these calcium gated channels are having a protein called as syntexin. I'm not writing it again क्योंकि मैंने already लिखा. Synaptobrevin and syntexin. Okay. Now look what is happening. The entire problem starts the moment you take the food. Let us say there is a food here. This is having exotoxin. Now I have eaten that. Now when I eat that, what is happening? This exotoxin is entering into my body right now. Okay. What is happening? You see, this is called as exotoxin. Abhi, this particular exotoxin is having two units. वो रेड कलर में जो दिख रहा है आप लोगों को, that is called as A subunit. That red color one is called as A subunit, and the next one which is carrying that red color one is called as B subunit. What is it called? It is called as B subunit. Now look what is going to happen. What is going to happen is that this particular one will damage your stomach, the lining of the stomach. Okay, it will damage the lining of the stomach, and slowly it is entering into your blood vascular system. Okay, after entering into your blood vascular system, within the blood vascular system, the A subunit and the B subunit, both of them separate. Okay. Once this A and B subunit, both of them separate, what will happen now? Only the A subunit is entering inside your presynaptic vesicle. Okay. This A subunit, you know what it will do? इसका नाम है A subunit. This is A. This A subunit, now it will go and damage your synaptobrevin. It will go and damage your syntax. Now, once this A subunit will go and damage your synaptobrevin and syntaxin, you know the story. Vesicles will not fix, vesicles will not blast. So there is no acetylcholine. Agar acetylcholine nahi hai, then what will happen? Then there is no muscle contraction. No muscle contraction. If muscle is not contracted, can I lift my hand? No. My muscles will be fallen down. This is called paralysis. What kind of paralysis? Spastic paralysis or flaccid paralysis? This kind of paralysis is called as flaccid paralysis. This kind of paralysis is called flaccid paralysis. Batao, everyone understood this or no? Yes or no? Jaldi batao, fatafat. Be fast. We shall finish up the symptoms and then we shall leave today. Very good. So what will be the symptoms? What will be the symptoms is that, for example, when a neonate is affected, when an infant is affected, I told you, we will get a problem called as infantile botulism, right? Yeah, this is how the infantile botulism looks. Actually, the baby is not sleeping. The baby muscles are all paralyzed. The hands are paralyzed. Everything is paralyzed. So when you take the baby in the hand normally, because of the reflexes, the baby will immediately contract like this. You're getting it? You lift the baby. This is a baby. You lift the baby like this. The baby will immediately contract like this. This is one type of reflex. Okay. But the baby is weak, drooling, drooping. You know? This kind of baby, you call it as floppy baby syndrome. This kind of babe, you call it as floppy baby syndrome. So let us see what are the different kinds of symptoms we have in a patient. The first thing is that you ingest the food. First, what is the damage that is happening? You see, first damage is happening to your stomach wall. So patient will have gastrointestinal upset. First thing. Second, third, fourth, fifth. Just remember 4 D's. D, 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 D. Okay. What does D stand for? D stands for diplopia. D stands for diplopia. Duino is rhenia. You call this in Russian. Okay. Diplopia. Diplopia means double vision. You see 2 boyfriends, you see 2 girlfriends. Your girl is a copy. Okay. Your boy is also a copy. So there are 2 boyfriends, there are 2 girls. But the bad thing is that the same person you will see again. Okay. Okay, Vraj. Right. So you see diplopia over here. Next important thing is dysphagia. Next important thing is dysphagia. After dysphagia is inability to eat. Q, because his muscles in the buccal cavity are not working. His esophagus muscle is not contracting. Next, dysarthria. Dysarthria means the patient will not be able to talk properly. Why? His muscles are not working. Next, dyspnea. Dyspnea means his respiratory muscles are not working. So he won't be able to take sufficient air inside. So he will have dyspnea. Clear, all of you? So these are the 4 important symptoms. Okay, 4 important symptoms. Okay, sir, then what are the symptoms that you see in a baby? Will the baby talk? Will the baby eat by himself? No. So what are the symptoms you have to notice and tell to your doctor is that first thing, you see muscles are not working. So intestine will not contract. If intestine will not contract, the baby will not pass the feces. So the mother will complain to the doctor telling that my baby has not passed the feces from 2 days. So that condition you call it as constipation. Second important thing, the baby cannot control his buccal muscles. So the saliva keeps on drooling down. Drooling. Third important thing, whenever I'm taking the baby to the breast for the milk, for milking procedure, right? My baby is not able to properly suck the milk. So that is called as poor suckling. Poor sucking. So these are the three complaints that a mom gives to a doctor. Okay. So this is the topic. The last point I want to tell you is, do we have any use with the help of this botulinum? Botulism, this botulinum toxin की वजह से, can we use this toxin in the medical procedures? बताओ, yes or no? निधि जैन, wrinkles, see the cosmetic पे ही जाना है ना? Directly you want to go to the cosmetics, beauty and all. Medical use, okay, that is a cosmetic use. Medical use I asked. Now this thing which I'm telling you is not in your micro, right? Not as an anesthesia, Sultan. Anesthesia, you won't give this as an anesthesia, no. Now what I'm telling you is, all anesthesia, you will give anesthesia to decrease the pain. Okay, here muscle contraction will be reduced, but pain will be there. So from medicine point, from physiology, not in physiology, from your medicine and internal medicine and pathology, it will be given here. So first important thing is, for example, let us say in my body, unnecessarily my muscle is contracted, muscle spasm. Sometimes you might have muscle spasms, calf muscle and all. If the spasm is too severe, simply give one injection of botulinum, and those injections are called as Botox injections. Botox injections. You give one injection of Botox, bus, everything will be fine. Okay? You give one injection of Botox, everything will settle down. Second important thing. What is the second important thing? Second important thing is that there is one medical condition. Okay? What is that medical condition? This is your esophagus. This is your stomach. This is your stomach. All of you should know one very important thing, that in the lower end of the esophagus, you have got a sphincter like this. Ye sphincter ka naam kya hai? The name of the sphincter is lower esophageal sphincter, LES. LES matlab very good. 37 group, Kajal Patel, very good. So this is called lower esophageal sphincter, or also called cardiac sphincter. Very good, Rajvardhan. Cardiac sphincter. Okay. In some conditions, what will happen is that yes, sphincter contract ho jayega. It will be contracted too much. When the sphincter is contracted and it is not relaxing, the food, whatever you're eating, can it pass to the stomach? Batao. Will this food pass to the stomach? No, it won't pass. When the food doesn't pass to the stomach, after some time, after a few months, the patient condition will be like this. The sphincter is tightly contracted, and see what has happened. The esophagus is dilated. Yes or no? The esophagus is dilated. So this condition, you call it as achalasia cardia. Achalasia cardia. Okay. Now to this contracted sphincter, अगर वहां पे मैंने botox injection दे दिया तो क्या होगा? Sphincter will relax. The food will pass down. Yes or no? So can I use it in case of achalasia cardia? I will show you this thing. ये देखो, all of you look at this. You see how widely the esophagus is dilated. है कि नहीं? Esophagus dilated हुआ. और यहाँ पे देखो, it is contracted here. Why? Because this is the point where the lower esophageal sphincter is contracted. Isn't it looking like a bird beak? Bird का beak जो होता है, isn't it looking like a bird beak? Yes or no? ये देखो. So this condition you called as bird beak's appearance. Bird beak appearance. Bird beak appearance. So when such patient is coming to me, guys, I will tell the doctor, for example, if a patient is coming to me, he will tell the doctor, whenever I eat any food, I'm vomiting it out, I'm not able to do. Then the doctor has to tell that, okay, हम X-ray निकालना पड़ेगा इसको. Sir, but doctor, esophagus के अंदर there are no bones, right? How will you take an X-ray? I will use such an X-ray. First of all, I will give you one solution. Solution का नाम है barium. You drink that solution. After drinking that solution will coat entirely your esophagus. Now I will take an X-ray. Okay. So this is called as what? Barium swallow. That procedure you call barium swallow. So bird beak appearance on barium swallow is always barium swallow is always and always your what? Achalasia cardia. The last point in today's lecture I want to tell you is there is another condition. ये देखो ये normal esophagus है. This is your normal esophagus. There is one condition where your esophagus is contracted everywhere in this way. You see, esophagus is contracted at every point here. So can I call that esophagus is contracted diffusely? So this condition is called diffuse esophageal spasm. Diffuse esophageal spasm. ये देखो, all of you look at this esophagus. Isn't it diffusely contracted? Can you identify this on 2 X-rays? Barium swallows. Yes or no? बताओ जल्दी. So okay. Very good. So this is diffuse esophageal spasm. So even in diffuse esophageal spasm also we give this injection. Okay. So guys, all of you understood everything which I am, and MCQs bhi hai. MCQs I won't discuss now. I will put it in the group. You answer me. Okay. So all of you understood everything which I've taught today. Yes or no? Fatima, you understood. Nikita, Raj, Nidhi, you understood. Sonu, very good. Hasti, very good, very good, very good, very good. Perfectly understood. So this is what I mean by clinical approach. Clinical approach मतलब ये है. अभी मैंने पता है यहाँ पे physiology, यहाँ पे I have barium swallow is a solution, guys. You take the solution, and so that your intestines will be coated with that barium, you take an X-ray very clearly. You can see that is the only thing you need to know. So in today's lecture, I have included micro, I have included physio, I have included medicine, and I have also included pharmacology part. 4 subjects we have covered. Now, if you go back, even if you ask your seniors, what is diffuse esophageal spasm, they will always tell you that it is present in the final year and all. Okay. Yeah, path also we included. Path also we included. So this is how I want you to study, guys. Even if it is anatomy, micro, कुछ फर्क नहीं पड़ेगा. You have to include all the subjects and study. Okay. Clear, all of you? Don't worry, I'm here to help you. But today's session, all of you understood, and Merry Christmas to all of you. Okay. Right. Okay, then fine. Goodbye. Take care. I'll send you the PDF. I'll send you the PDF in the group. Take care. Goodbye and love you all.